How important is maternal mental health and how can society help with it, especially on Women's Day?
On a Women's Day, what we are trying to emphasize is on the overall empowerment and taking care of that particular category, which is actually reflecting the general health of the society. It's said that the general standard of the society is reflected by how it is taking care of its women and the children. So when we talk about the women's health on a Women's Day, you can't overlook the importance of the mental health too. And when we're talking about the mental health, it need not be necessarily about getting a counseling or going to a psychiatrist or anything, but coping up with the daily challenges is a basic thing. Especially during a maternity period, that is during the pregnancy and immediately post-delivery, is a time period which is actually very heavily getting taxed on a woman with regards to her mental health, because she is undergoing a major change in her role in her life. So even in our society, especially when our culture has changed toward this nuclear family culture. Previously, when it was a joint family, there were so many people around, so many aunties around, your mother was there, your grandmother was there. So many, it doesn't mean that everyone was doing good only, that we have flaws of those type of culture, but actually you were surrounded by a set of people of different generations. So you used to get, the lady used to get input from all the sources, and they could process it in such a way that they were taken care well in their emotional side while going through their pregnancy and the delivery period. Now our situation had become such a way that you are pregnant, you are there at your home, might be the maximum you are getting your mother, that lady, the girl getting her mother aside to take care of her during the pregnancy time itself have become a big luxury to you. Most of the times you and your spouse are alone in the family, and only during the delivery period or some need arises, your parents may appear, and it's not fair to ask them to come and stay with you all the time because they have their own life. So this situation brings out the real challenge of addressing the woman's health, especially during the pregnancy and post-delivery period in a professional way. One thing we have to understand that there is something called as postpartum mental stress, which can go from just being a gloomy mood to a very hypermaniac mood. So this is a big time mental fluctuation period. So this has to be addressed scientifically. I would say it has to be addressed much before the delivery itself, because even during the delivery period, even from actually 4th month or even 5th month, they give out a specific symptoms or sometimes a red flags which shows that she might go in for a postpartum mental stress, which could be a depression or any kind of thing. We generally, in a layman term, we call it as postpartum blues, but it has got a big spectrum. You can't always call it as a postpartum depression, but obviously depression is the worst part of it, we can get it. But this has to be picked up on earlier during the pregnancy period, and gynecologists nowadays are actually putting mind into it and trying to pick up there is any mental challenges, emotional challenges she is facing, and trying to help her in a professional way by sending them to a counseling psychologist who may pick out sometimes surprisingly some stress which she is undergone, which her spouse or even family has never imagined. So those has to be done, but now even sometimes even after delivery also we can pick that out. But the most crucial thing is the understanding by the partner and even the family, and not to take it in the wrong sense that she is showing some attitude or she is having some other problems. But one thing has to be made clear, that she need not have any kind of prior history of any mental challenge or stress or any other kind of thing. Just because the simple hormonal changes which is happening in the pregnant body and immediately the post delivery time, those hormonal fluctuations itself can induce or ignite a kind of mental stress and signs of depression. So those things has to be considered very empathetically, and doctor has to play a very vital role in that. And at the same time, family is the pivotal key which has to give her a big support during this time.